Okay, so welcome to this first introductory lecture on the Diploma in Caregiving program. By way of outline, we would discuss who is a personal care aide, also called a caregiver, also called an health aide. These are some other nomenclature for that entity. We'll also discuss the duties of a personal care aide, and we'll also discuss what is covered in each module. We have 14 modules in all. So we'll give a brief overview of what each module entails. So who is a personal care aide? Personal care aides are important members of the home healthcare teams, and they aim to provide healthcare services that is outside of the traditional healthcare settings, such as hospitals or nursing homes. The traditional healthcare settings are the hospitals, nursing home, but they're also persons that would want to continue their healthcare within the comfort of their own home. That is where the health caregiver or a personal care aide comes in. And receiving health at home would allow patients to remain within the comfort of their own homes, surrounded by the people and the things they love, while getting the best care that they need. Helping people meet their needs by providing or assisting with personal care gives these professionals the opportunity to build relationships and connections with people when they need them most. And taking care of people is essentially what a profession in personal caregiving is all about. So what are some other nomenclature for a personal care aide? So should you have a job advert that is advertising any of this position, having a diploma in caregiving enables you to be able to apply for such. A caregiver could also be called personal care attendant, personal care aide. Could also be called a home health aide or home health giver. Could be called a hospice caregiver, could be called a home care assistant or a home care worker. Excuse me. So what are the duties of a personal care aide? The main duties and responsibility of a caregiver would include: 1, providing personal care, such as helping a patient have his or her bath, showering, shaving, oral hygiene, and dressing. Then some personal care aides would also administer medications, oftentimes oral medications, to the patient. Then they help to monitor the health and the well-being of the patient. Should be able to take basic vitals for their patient or their client at home. Should be able to do a glucose check and some other health monitoring that may be required for patients per time. Then they would also maintain the records and report any changes. Your profession requires that you take notes. If it's not written, it's assumed it's not done. Then taking note also allows to have a detailed overview of what the patient's state of health has been like in the period gone. Then some personal care aides would also assist with meal prep and household tasks, and would even assist with feeding their patients or their clients. Then they also offer emotional support and companionship, especially for elderly people who live alone at home. So now, what is covered in each module? Module 1 will focus on what home care is all about. When someone says, I'm taking home care, or someone says, I'm offering home care, what is it all about? The history of home care, how did it come to be? And who are the part of the home care team? Then in this same module 1, you'll be introduced to the variety of tasks that a home health aide or a personal caregiver would perform, and the important role that they play in the home healthcare team, because the team consists of the doctors, the nurses, the caregiver, the social worker, and a number of other professionals. So the role of the personal caregiver would be itemized in details in module 1. And module 2 has 3 sections. The first section will focus on the physical and psychological needs of every human being, be it someone who is taking home care or someone who is healthy and does not need that. We all have a basic psychological and physical needs that humans will need. So we'll discuss that. Then we'll also discuss the influence of culture on our behaviors, on our values, and even on our healthcare practices, and preferences. Excuse me. In the second section, we'll learn how to effectively communicate with our clients and to develop a positive working relationship with patients. You'd also learn how to properly document the care provision, whatever it is you do for a patient, you will learn how to document them properly. And in the final section in Module 2, you will learn the types and the signs of abuse and how to protect patients' rights, such as the right to privacy and confidentiality. Now in Module 3, we will address the special needs that the elderly patients would usually encounter. So we would also learn about the societal attitudes about aging. There are some myths, there are some truths, there are some facts about aging. We'll discuss that and how this societal attitude will influence the well-being and care of elderly patients. We'd also learn about the physical and the psychological changes that can occur as people age and how to best meet the needs of the elderly patients. So in Module 4, we would hope to focus on the unique needs of children who receive home care services. There are some children that will need to have home care. That could be a child with autism, a child with cerebral palsy, or a child who has a fracture and the parents have to go to work and they will need to employ a caregiver to give health at home in the meantime. You'd also learn about the physical and the psychological changes that will occur throughout the development of an individual from infancy to adolescence, and you will learn how to help these children and teens cope with the stress and other things that may develop from needing home care, and you would also help them to you would also learn how you can help them develop positive coping skills to the adversities of life. So in Module 5, we'll examine mental health and mental illness because some individuals who struggle with their mental health may need home care. That could be someone with bipolar, severe depression, could be someone with schizophrenia. But specifically, we discuss mental health issues like anxiety, depression, and schizophrenia. And the aim is to be able to focus on how you as a health caregiver can come in to offer effective service to these individuals. Then Module 6 will discuss developmental disability because some of these personnel would also need home caregiver, and we pay special attention to intellectual disabilities, cerebral palsy, autisms, and neurological impairments. And you would also learn how to effectively work with patients who have a developmental disability, and with the hope that they will be able to function as independently as possible, even with you being there offering them home care. Now in Module 6, we'll examine what a physical disability is, the various causes of physical disabilities, the difference between a physical and a developmental disabilities. And you would also learn about the special adaptations that people with physical disabilities may need and how the home health caregiver will be able to best work with persons with physical disabilities. Now in Module 8, we'll address the basics of nutrition. You learn about the important role of the major nutrients such as carbohydrate, proteins, fats, and how the roles that they play in people's physical well-being. And the various diets, you also learn about them: low salt diet, low fat diet, vegetarian diet, gluten-free diet, mechanical diet for people with swallowing difficulties will be covered. And you would also learn about food preparation techniques and food safety, food hygiene essentially. So now Module 9. In Module 9, we hope to discuss money management, how you can help patients effectively manage their money and develop a budget. You would also learn how to help the patient track their expenses and plan a budget based on their income and household expenditures. Should you work in a civilized environment where funds are well structured? You work with an elderly individual who has a certain amount of money coming in every month and must ensure that that money carries him through the month. You need to have some basic financial understanding of how to work with budgets and track expenses. And you would also learn guidelines for helping a patient cut their grocery, household, and energy costs. Excuse me. Now, Module 10, we would focus on the importance of and how to perform housekeeping. As a healthcare giver, you will learn how to use proper body mechanics to prevent you from getting injured and you injuring your clients, and how to develop task lists and to prioritize lists and tasks in order of their importance. You'd also learn about various cleaning products, how to perform specific housekeeping tasks in each of the rooms, the kitchen, the bathroom, the bedroom, the living room, how to even do laundry. It may be you doing it and you may be the overseer of such a responsibility, but whatever the case may be, a sound understanding in this area is also key. So that will be covered in Module 10. Now, Module 11 will examine the types of injury that can happen in the home. That could include falls, burns, cuts, poisoning, choking, fires, hazards, and the likes. And you would learn guidelines on how to prevent such injuries. But should such injuries happen, you would also learn some basic first aid information for handling this injury, and special attentions will be paid to learning how to deal with some serious medical emergencies that can happen at home. That could be heart attack. What would you do before the medical personnel come? And that could be seizures, that could be strokes. What are some things you can do in the immediacy of the occurrence before the medical personnel comes? And in Module 12, we would focus on how to provide personal care for the home care patients and the importance of infection control, the role of the home healthcare aid giver in preventing infection transmission. And we'll also cover tasks like bathing your client, feet and mouth care, dressing, grooming, assisting with toileting, eating, even transferring the patient from the bed to the wheelchair, assisting the patient with self-administration of medications are also covered, and you learn how to care for an infant during handling, because you may also be a home caregiver to a newborn, to an infant, so you learn how to care for them. That will include their handling, their feeding, and their bathing. So then Module 13, which is not covered here, is special topics on some basic clinical procedures that you should be able to do at home for your clients. That could include change of wound dressing, just some basic clinical procedure. We call them special topics. The theoretical part will be taken care of, then you would also have hands-on practical, just so that you can effectively serve the needs of your patients within the home. So you're welcome.